As a mental health worker or someone affected by mental health issues, what is one thing you would want to say to educate people about mental health and to lessen the stigma and shame surrounding it? As someone who struggles with PTSD, I would like to say that I don't choose to be as repetitive and exhausting as I can be. I will react the same way to the same situation because that is an association that has been with me for half my life. It's very difficult to keep opening up to friends without feeling like a burden because you cannot cope with the same thing as last week. They have heard me talk about it so often and given me several pieces of advice on it, and I hate feeling like this broken record. But to me that is a core part of this disorder. Physical therapy is seen as a regular part of recovery from any serious injury. There's no stigma attached for someone in a cast or a wheelchair to see a physical therapist. Mental health counseling should be considered in the same light. We know we are acting irrational, but it's not something we could help, especially if it's something like PTSD or anxiety. Some days are just harder than others, but that doesn't mean we aren't trying. Just being there for us is enough, and we appreciate it so much. Something to help with the stigma? Most people don't see mental illness until it has manifested itself outwardly. You know, the homeless guy yelling at a trash can type of thing. Realize that you are looking at the extreme end. Thinking that is what mental illness is like thinking someone with 90% of their skin scorched off is what a burn looks like. I had debilitating OCD, afraid to swallow my own saliva, couldn't use old cutlery or cups, and needed to touch everything an even number of times or my soul might switch with that of an object. Nowadays I basically only double tap escalators and big silver pull doors because I'm afraid they'll static shock me, not the soul switch thing. As someone with bipolar, I always compare it to diabetes. It's a lifelong condition, usually managed by medication, though occasionally people manage without. The medication isn't always perfect, so you have to let those around you know the warning signs. If you stop taking your meds suddenly, you will have serious problems and may embarrass yourself in public. Sadly, I've recently had to add an extra section to my explanation as part of an apology. If you're diabetic in hospital waiting for your foot to be amputated, even if you took your meds perfectly, you get limited sympathy if you spend every weekend stuffing yourself with cake. For bipolar, the equivalent tends to be booze, drugs, and god dang is the level of substance abuse high amongst us. ADHD exist. It's not just being hyper or a condition therapists invented. If I was diagnosed as a kid, I might have gotten on my meds sooner and finish high school. I'd also like to add that ADHD doesn't always present as hyperactive impulsive. There's also inattentive type, and then a combination of the two. We know that sometimes you don't understand us, but please consider that sometimes we don't understand either. As hard as it is for you, imagine how hard it is for the person suffering through it. I don't know why I have to flatten out every single wrinkle in the sheet before I sleep, and I know my boyfriend is tired and wants to go to bed too. But if I don't, I won't be able to sleep and will be itchy all night. We're doing our best. Please just be patient with us. You can't just tell a depressed person to go out and talk to people and have some fun. Depression kills the will to do anything. Yeah, but if you did go outside you'd feel better, so it's your fault. It hurts to know that you can't trust anyone. You never know when someone is going to sell your secrets and tell everyone about that one thing you did when you were extremely ill just for some karma. You hear stories of crazy people doing weird things and know that someday you might be the crazy person people talk about for morbidness. And to get better you always need to trust nurses and doctors, and yourself. And that's hard to do when you're seen as an anecdote and not as a person. Please don't ridicule me for my coping mechanisms. I like to color to help ignore thoughts. If I'm doing that instead of do tasks, then I'm really struggling. I make animal sounds or other weird noises to distract myself. Coping mechanisms can be strange, but alienation certainly doesn't help. Color the world, my dear. Color the world. You're dealing with people who are essentially running with one leg in a two-legged race. The bar for success for the mentally ill is much different than everyone else. For instance, someone suffering from severe depression making it to old age is sometimes a great featuring. It certainly kills many before they get there. I can't answer the phone, can't drive the car sometimes, even fill groceries or prescriptions, can't go to sleep, can't deal with criticism. It's like entropy. A small thing grows all on its own into an unrelated mess of disorganized anger and frustration, often over nothing tangibly real. But it's so real to me, it becomes panic or anger at myself. To combat this, I feel the need to be perfect constantly. You could consider this a benefit. I often outperform my peers, but if I fail, even a little, I'm a failure to myself. I lost a hat in January and I'm still punishing myself for it. So to you, on the outside, I do everything right and that makes you think I'm okay, annoying even. I make good enough money and I'm successful in my field. But the moment I'm alone, I pull the skin off my scalp with my fingernails and have almost no close relationships. I can't control how I feel. I know it's not normal, but I know I do everything I can to try to cope. I probably didn't answer the question, but that's the edit. Just because someone looks okay doesn't mean they are okay. I have a full-time job. I have a house. I have a decent wage and I'm doing okay for my age. I also have borderline personality disorder, depression, anxiety, possibly PTSD, and traits of other personality disorders. I appear to function on the outside, but inside I struggle every day. I co-own my house with my dad, and despite living with me, even he thinks I'm okay. People who are suffering often bottle it up in an attempt to not be a burden or to just try and get on with life, but it wears them down. Reach out to your friends and ask how they are. Let them know you're there for them. And if they disclose they have a certain disorder, do a little research. Think about how it affects them rather than how it affects you. You can't make them talk to you, but you can show them you're there. Therapy isn't only for the mentally ill, nor is it a cash grab. Therapy works. Not every therapist's the same either, so while some may not work for you, others will. Therapy works. I have bipolar and CPTSD. While the pharmaceuticals are essential for maintaining my sick brain chemistry, I can wholeheartedly thank the almost 3 years of therapy for allowing me to perform inherently simple tasks which were once extremely difficult to even think about. Therapy is such a powerful tool, saved my life in more ways than one. Stop assuming everyone who skips school or doesn't come to work is just lazy or doesn't give a crap. Some of us peps with depression have a hard time even getting out of bed, and you making nasty comments about us being lazy only makes it worse. Yes, I hallucinate. Yes, I have voices in my head. Yes, I'm not exactly completely sane, but that does not mean I can't function. I can still hold conversations. I can still hold relationships. I can still be relatively stable in public. Also, I am not my mental illness. Do not see me as the depressed kid. See me for who I am. There is so much more to a person than their mental state, and mental illness can affect anyone. Age, race and gender have nothing to do with it, except for gender dysphoria. A 4-year-old can experience PTSD and so can a 30-year-old. It's all about environment. Good for you for pointing out that you are not your disease. Part of the battle is reclaiming yourself. I know I overreact. I know I'm too sensitive. I know I make things difficult. I know all of these things make you uncomfortable and inconvenience you, but maybe just take a second to think about how much they affect me. Add overly emotional, have irrational thoughts, and keep hearing those criticisms over and over in my own head. For years, I'll never stop feeling guilty for some of my actions and decisions in my lifetime, or even my current ones, because of all the negative reinforcement and feedback. I would like to say how wonderful my patients have been. Most people are just looking for help and support on their way to recovery, like you would do with any physical illness. I mainly work with schizophrenia patients, and I am lucky to have met a whole variety of people from different backgrounds, with different interests and hobbies, who go about their lives like everyone else, just with a few more difficulties along the way. Stigma is still real, despite the awareness campaigns. I suppose it's best to remember that people with every type of mental health disorder live by your side. They may be your neighbor, your teacher, your employee, your friend. Don't isolate these people from society. Help them by creating opportunities for them to join in. If you are in the UK at the moment, there has been a good series of mental health documentaries that you can watch on iPlayer, including Psychosis and Me, Anxiety and Me, and Depression and Me, as well as the latest from Louis Theroux. I highly recommend you check them out. I would say the prevalence of antagonist characters that are usually misrepresented or grossly inaccurate mental health issue is a problem. Same for a lot of true crime documentaries and the like, where they speculate on whether the perpetrator might have had some kind of mental illness without explaining the illness correctly, or write off a person's actions as being down to the effects of the mental illness. I can tell if someone has been influenced by this kind of crappy pop culture by the way they look at me and others. No, being bipolar does not mean I might murder you for no logical reason. In fact, it makes me statistically more likely to be murdered or a victim of abuse. I hate being told that my decision isn't mine because I am autistic. For example, I wanted to go to a school where all of my friends were going. I was repeatedly told to not go because my autism chose it and the proper adults should choose where I go. I had also stayed with my aunt who padded the walls with pillows and kept feeding me organic locally grown vegetables for the weekend to cure my, and in her words, retarded butt brain. Have also been bullied and made fun of and beaten by other kids because of my autism. I'm sorry, people suck. Everyone is unique and so is their experience with mental illness. No two people with depression will experience the same thing, nor will two people with anxiety react the same way to the same things. We literally have no control over what our mind is doing, feeling, or how it's going to react to anything. There is zero control. Be understanding that this is much harder for the sufferer than it is for you. Your brain is an organ, and like any other organ, it can get sick or weakened or simply not work as strongly or efficiently as it used to. You wouldn't expect someone to just get over or snap out of a heart attack or kidney failure. It's unfair to expect the same of mental illness. Suicide isn't an egoistic choice. If a severely depressed person committed suicide, she did it because they felt that the people left behind would do much better without them. They actually commit suicide to help relatives and loved ones. People are coping the best way they can based on their experience. For example, someone who yells and turns people away can just be trying to comfort themselves based on past experience of letting someone in and being hurt by it. Treatment is about learning new coping skills that will give people comfort that also gives them other things they need in their life, relationships, stability, etc. I know this isn't exactly what you're asking for, but as someone who works in mental health, has suffered from mental health issues and has witnessed some of the effects, get off social media. Reddit isn't too bad because it isn't tied to your personality and identity, but get off Instagram, Facebook, Snapchat and any other media that is linked to your real identity and self-worth. Those platforms are directly responsible for more harm to young people's mental health than everything else combined. I know of multiple suicides, attempted suicides and self-harm cases that are a result of interaction on social media. I work in the NHS and we can't keep up with all the depressed teenagers that come in with depression and anxiety brought on by social media use. This in turn is stopping us from treating serious cases of mental illness. Every single young person who has deleted their social media accounts on professional advice, in my service, has immediately felt a significant improvement in their mental health, their self-worth and a reduction in their anxiety. Please, if you do nothing else this year, delete your social media apps. Wait for the withdrawal to wear off and feel the freedom that comes with not feeling like your whole life is on show and that you don't need to prove anything to anyone. As much as I wouldn't wish my mental illnesses on anyone, there have been many times I wish someone could live in my head for just one day. The constant thoughts of ways and planning and just running thoughts of suicide and anxiety about the simplest of things is so very exhausting. And as much as I would love to just get over it, it takes a lot of work to feel like what I imagine a normal person must feel like. Also, I need those meds just as much as a person with heart disease or other chronic illness needs theirs. I cannot function without them and therapy. Stop saying I don't need them. BPD is not inherently abusive, and people with it can be good people and live normal lives. On that vein, not everyone who acts irrationally in a way that offends your sensibilities will have BPD, and if you know someone with BPD who acts a certain way, that's likely not universal. Just don't stigmatize and overgeneralize. You worded what I was trying to say in a much better way, comrade. I want people to know that wrong treatment and diagnosis can set back a person's recovery by years. There is nothing wrong about not having chemistry with your therapist and finding someone better suited to help you. My battle lasted for years and nearly killed me. I spent more time in hospitals than at home. Pushed back and forth to different facilities cause nobody would take responsibility. I was stuck. Then one day one of the chief doctors decided to send me the frick away to another district and everything changed. They gave me time. We spent 6 months doing tests. New diagnosis, right diagnosis. Today, no self-harm, no episodes, no hospitals for 9 years. I was the patient they thought would die in the system, or to self-harm, or suicide. I was that patient, and by that you all know what that means. The point in all of this is, get proper treatment, never give up, never stop fighting for your right to be better, to get the help you need. Cause it will get better. Don't settle no matter how hopeless it is. Wrong diagnosis and medication matters more than you think. I believe in you. I am bipolar. People don't know how to react when you tell them you're ill, which I understand of course. We talk a lot about people that are mean or treat you like you're crazy and stuff. It sucks obviously, but we talk so much about them that we forget about the other side of the coin. When people are too benevolent or sympathetic, they can also cause damages. I am surrounded by friends and by my family and they all support me, which is great and I'm very grateful for that. But sometimes, or always, they have absolutely no idea what to say but feel like they must say something no matter what. They usually try to reassure you, but doing this they just get the opposite reaction. I call it minimization. Basically, they tell you not to worry. What you're experiencing isn't that bad, don't be afraid. They also feel like this sometimes, it's gonna be fine. Stop doing this. It's the worst. Imagine you feel like crap or that something's really wrong and you're afraid. And then someone tells you, "Mate, it's okay, everybody have ups and downs." All my friends and my family, except my sister, do that. Now every time I felt like something's happening, I'm asking myself, do I really need to see my doctor? Is there really something wrong? Am I faking it? So yeah, not useful at all. I'd rather be told to worry so I can get some help instead of keeping it to myself. Also, it's painful and really annoying, so now I just don't talk to anybody at all, except my sister. What does she do? What do I personally want people to do? Just listen to my rants or worries or news from my doctors. But don't say anything, except that you will never understand it, so don't try to give advice. Judge. Yes, some friends told me I take too much meds and that they worry, relate, reassure, etc. I just need a shoulder to cry on and that's it. The only people that I will listen to are my doctors, and that's it. It's my personal situation, so maybe other will disagree with me. Mental illness can happen to anyone, literally. It's as common as physical illness is, like the common cold. Part of removing the stigma is to talk more openly about it, to stop the whole hush hush, behind closed doors thing. Anxiety and depression are among the most common, and lately I've seen a rise in eating disorders. Looking at you, influencers who promote body dysmorphia with plastic surgery they claim is achievable with diet and exercise, and especially influencers who push intense diets and weight loss products. You are literally causing damage to people with your pursuit of fame and money. Bipolar, schizophrenia and personality disorders are treatable. They're not something to fear. Important to note too, the personality disorders can be incredibly mild and don't necessarily need treatment unless it impacts your life negatively. There is literally nothing wrong with having to take medication for a mental illness. It doesn't mean you're creating artificial happiness or a dependency issue. You're correcting your brain's shortcomings with the resources that you have available. We do what we have to do to improve our mental health. It's like eating food. Have to eat to stay alive. No big deal. I think my concussions have fricked me up permanently. I grew up playing hockey every day for 15 years, trying to make the NHL. But after being knocked unconscious for the 10th time, something changed. My long-term memory is non-existent. I'm very irritable and depressed. I can't look people in the eyes anymore. I went from social butterfly to a complete hermit shut-in that can't bear being in public. Are these things correlated? My parents refuse to believe they are and they think I'm being dramatic. I'm not. I think about suicide on a daily basis. I was never like this until my last violent head trauma. I've probably had over 25 instances of severe head trauma. At least, I only know for sure of the ones where I was knocked out cold. As someone who suffers from schizophrenia, one thing that I hear the most is, shouldn't you be locked up? Seriously people, I thought society has moved past the point where psychopaths in horror movies represent what a disorder is actually like. No, I will not murder your child. No, I will not commit any other crime you might be thinking of right now. Relax, we aren't as dangerous as you think. In fact, we aren't that dangerous at all, most of the time. Why not give me a goddamn chance? I have a mental illness and will say this. We're usually more scared of you during a psychotic break than you are of us. If you wish to understand someone with a mental health condition, please educate yourself and research the condition. I have a lot of people who claim to know and try to give advice. Once you've worked with professionals, the average person's advice can become awkward and patronizing at times. Learn before you weigh in. It's a very sensitive subject and would go some way to lessening the stigma if more people educated themselves. Don't stray away from a person if they confess their struggles to you. They're probably in a very difficult situation and trust you enough to tell you about it. You should get informed about their mental illness and try to fix it with them. Or just be supportive at least, or get someone who can help more than you involved, but I just beg you, don't under any circumstances stray away from them. I would say probably don't fix it with them. More often than not, just being there for them is enough, and having someone try and fix you is the worst. I was diagnosed with bipolar 2 disorder and depression about 2 years ago, which to me was a relief. Until that point, people close to me would sometimes point out that I seemed to be out of it. I'd be extremely emotional, unable to focus, and paranoid to a lesser degree than the other two, but still, over time, I had become desensitized to these things and they became my new normal. After starting medication, then forgetting to take it, followed by a short involuntary commitment to the local hospital, and then constant and proper use of my medication, it hit me. Before seeking treatment, I just didn't know anything was wrong. My point is, we often don't know something is going on until others point the signs out to us. I sure as heck didn't. Nowadays, I'm doing much better. The depression is under control and the bipolar 2 stuff is mostly controlled. I do have manic episodes once in a while, but it's usually just me starting to write about stuff and becoming bored. The depressive episodes don't happen anymore. Yay. I'm starting my senior year at the local university in August, so everything is looking good from here. Maybe I'll meet someone and end up with a girlfriend. Who knows? So yeah, look out for the people you are close to. You might be the first one to pick up on something. Those struggling are often experts at hiding it. Just like how it's extremely hard to spot someone drowning in a crowded pool, it's almost impossible to know who of your friends, family and peers is struggling with their mental health if they don't tell you. I can guarantee you that you personally know at least one person struggling with their mental health. If you don't know who it is, they are trying so hard to hide their issues because they are scared of how you, or others, will react. You might have spoken to them about their very issues, maybe even in a negative way, and never knew you were directly addressing them. Mental health isn't padded rooms and straitjackets, it's real people with real issues. There should be no stigma or shame for being a human being. Anorexia is not a disorder of vanity. I have this disease and am also doing my PhD on perceptions of eating disorders. Eating disorders are so incredibly complex. Yes, they are a disorder of control, but it goes deeper. As a start, if I could change one thing tomorrow, or would be the normalization of commenting on people's weight. Also, you can't simply assume the severity of this condition by a person's weight. EDs come in many forms. A lot of sufferers don't look like the media depicted version of anorexia. Be gentle on us and put down your assumptions. I try my hardest, but sleep overtakes me. I can't stop it. I'm tired 24/7. I want to be outside. I want to go out and do things, but I can't leave the bed without all my willpower. Nobody can continuously move upwards. If you go back a few steps, that doesn't mean you didn't go up those steps in the first place. You've done it before and you can do it again. Stagnating or even regressing is perfectly normal, entirely human, and expecting otherwise is irrational. The sooner you realize that, the sooner you'll be able to put the brakes on how hard you're crashing and start working on going back up those steps and further. If you met one person with autism, you've met one person with autism. It's a spectrum for a reason. Not everyone's super smart with a lovable tick like media loves to portray us. Some of us feel like crap because we're expected to be prodigies by even our own families. But some of us can't even do simple tasks without going through a ton of mental stress and burning out. Behavioral health tech of 3 years. I've had every type of person come through my facility. From your preschool teachers to executives of Fortune 500 to clergymen to college students. But no one is immune from stress and mental health. Don't let the fact that you're getting straight A's make you feel like you're not the ones that need a counselor. Or that because people usually vent to you that you don't need to vent either. Bad stress is bad stress. And sometimes, even for the ones that seem to have it all, can make a person crack. Get help before you crack. Because once you do, it's much harder to come back from then having too much stress. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.